Hello everybody. In this video you will be able to verify your knowledge of the communication skills. If you like to see again the videos about the communication techniques, please click on the link below the video. Don't worry, every question can have many different answers, so I have included only some of them, of course, and your answers can be as good as mine or even better. And the goal of this exercise is to help you to switch your mind to a different communication mode, because these skills, when you use these skills, it's a little bit different from usual communication. I know I should spend less time in front of the computer and to do some sports, but I have no time. So, how can you use simple reflection to promote something positive? Or use two-sided reflection, and use amplified reflection. So my answers are simple reflection. You feel you should spend less time in front of the computer. You feel some sports could be beneficial for you, or you have no time. And you can use two-sided reflections. For example, you have no time and you feel you should do some sports. So there is some positive part, some negative part, and then you end with the positive part, and you will use the end conjunction instead of but. Or you can tell, for example, on one hand you have no time, on the other hand you feel that some sports would be beneficial for you. So instead of but, you will use on one hand, on the other hand, and you put the positive part as the last one. And you can use amplified reflection. You have absolutely no free time. And during Christmas I have gained 5 kilograms. It's terrible. So you can reflect underlying emotions, or you can use weekend reflection, and you can also use open question to explore the feelings of the patient. So my answer is you can reflect underlying emotions, for example, by you feel guilty because of that. You may expect that she will need pine. You do not like your body, maybe she needs crab apple. Or all your effort has been futile, she feels hopeless. Or your will is weak, so maybe hornbeam could be useful for her. Or you can also use weekend reflections, because she describes she used the word terrible, and she is quite emotional. So you would like to calm her down, that it is not the end of the world and end of the life. So you can tell you feel disappointed by gaining these 5 kilograms. Or you can use open question to explore the feelings. So how do you feel when you have gained 5 kilograms? Whatever I do, the situation is the same. So you can use simple reflection, amplified reflection exploring underlying emotions. You can use open questions, or you can use affirmations. So my suggested answers, you can find yourself better. Simple reflection, the situation is the same. The situation has not changed. You can use amplified reflection to provoke the person to some reaction, to reveal at least some minimal change. You have already tried absolutely everything, and nothing worked. Or you can reflect the underlying emotions. You feel disappointed by previous failures, or you feel hopeless, and it is hard to mobilize your strengths to do another attempt. You can also use open question to explore these previous attempts. What all have you already tried? Or you can use affirmation to boost patients' self-esteem. In spite of failures, you do not give up, you are a fighter. How are you? And the patient answers you, I'm fine, but you can see there is some incongruity. He has a forced smile and you feel that something is wrong. And you can use simple reflection or use a reflection exploring the incongruity between the words and mimic, or you can also use amplified reflection. So my answer, my idea is you simple reflection, you feel fine, or you feel okay, or you have good days now. Or you can use explore the incongruity. You are saying that you are fine and your face is a little bit tense. Or you can use amplified reflection. Everything is absolutely okay. And maybe the patient will reveal that not everything is okay. The patient describes that his headaches have got worse 2 years ago and use open question to explore the possible connection with some life events, for example. Something has happened 2 years ago. So, what has happened in your life 2 years ago? Simple. How has been your life 2 years ago? Or tell me more about your life 2 years ago. So open question needn't have the question mark at the end. Tell me more is also an open question in the as a communication technique. You should also adjust your communication depending on the remedies you have prescribed to your patient. For example, the patient comes and tells you, I cook the dinner all the day, and then he tells me that his mother knows it better. I was so furious. I could hardly control my anger. So it depends if this is, for example, a Centauri patient. So her anger is something positive because before that she was submissive and she accepted bad behavior of her husband without comments, without any reaction. On the other hand, if she needs, if you prescribed her impatience, then the problem, then the positive part is that she controlled her anger. So use reflections, affirmations, and open questions in the case you prescribed Centauri and impatience. So in case of Centauri, you felt angry, simple reflection, or it was too much for you, reflection exploring underlying emotions. You did not like to bear it anymore, so guiding reflection, inviting her for some further change. You could also use affirmation. You became aware of your inner strength, of your anger. Or you can use open questions. Tell me more about this feeling angry, or how did you feel when you got angry? On the other hand, in the case of impatience, you will probably use reflections like you were able to control anger. Simple reflection, and it is also an affirmation. You were angry and you were able to stay calm. So this is two-sided reflection or affirmation. Or you can use open questions. What helped you to maintain self-control? The patient comes to you because of chronic muscular pains and all over the body. Although your therapy is partly successful, you would like to suggest him to start some sort of exercise like yoga or qigong in addition to Bach flower essences. So your task is to offer to the patient information about a yoga group in the city. So offering information is often quite a tricky matter. And you should always ask whether the patient really wants to hear it, and you should verify what he already knows about this problem. For example, I have an idea what probably could help you to improve your body feelings. Do you like to hear about it? It's offering information. What do you think about yoga, exploring patient's knowledge and attitude? And if the patient agrees and is interested in it, so I think that your physical problems are associated with a chronically increased tension in muscles, and yoga helps to relax the muscles. What do you think about that? Again, exploring the view of the patient. So you do not tell him just go to yoga, it would be beneficial for you, but maybe he has some aversion, you do not know why, but it's possible. And finally, you can add the information. There is a yoga group in the city and the trainer is very good as far as I know. Do you like to hear about that? So, thank you very much for watching this video. And in the next video, we will speak about the therapeutic dialogue. That is a core of the Bach flower therapy.